Hello, everyone. Okay, so here we are. Um, our Nursing 540 class in Module 5 this week, and I'm the team lead. I'm Dessa, and I am joined by Fong Trong, Beth Stevens, and Bridget. Is it Chartier or
Chartier is how we say it, but either way is fine with me, Dessa.
Oh, I was going to give it a little French twist to it.
Oui.
So anyway, this week we're going to be, I'm going to be the team lead and the submitter and the facilitator of the meeting. Fong is going to be the scribe and timekeeper. And we're still on our group. Our group has picked the 65-year-olds and greater patient population, older patients living alone. We're going to be talking about our ABPPP slides layout. Everybody has the agenda in front of them?
Yes.
Okay.
Yes, thank you.
So let's start out just number one, topic one, the recap of Module 4 and the health promotion plan that we submitted individually this Sunday. Fong, do you want to go ahead and start us out?
Yeah, well, let me see. Pull that up, sorry. Well, my health promotion plan was on a 69-year-old lady who pretty much has her independence, live alone. Her husband had passed away recently, so she was kind of battling some light depression, kind of residual when I spoke with her.
What interventions did you come up with?
My preventions was more education-based. I thought that she needed a little bit more information on the health management on her disease process. So with medication, she took Lasix twice a day. So instead of taking it twice a day, the latter part, I wanted her to take it a little bit earlier. Obviously consulting your physician, but instead of taking one that's at 8 or 9 o'clock at night, taking it at 6 o'clock, and then also just to minimize her urinary urgency, latter part when she's asleep. I also discussed her dietary and also fluid restriction. She also had a CHF, so I thought that was important for her to kind of restrict that. She didn't want to. She knew how to cook, but she, based on just being by herself, she didn't want to cook every single day, so she turned a lot to like frozen food, canned foods, and ordering out where it probably had a like high content of sodium. And also had her I also put her on a 1,500 ml fluid restriction, because she said towards the end of the day she felt like she gained like 10 pounds and she had a hard time breathing at nighttime. So hopefully that would minimize or decrease those signs and symptoms.
Okay. Very good.
And then also I also requested her to have home health to follow up to check her home environment for any risk of falls, any small objects, kind of adjusting her environment just to be a lot more safer.
Okay. Thank you, Fong. How about you, Beth?
I had the 80-year-old female. She lives at home, but her husband is still living and at home with her. She has type 2 diabetes. She's had a history of falling, but more related to tripping over like gardening equipment, pool equipment. And then she also had sleep problems. And so what her first priority with her diabetes is she consistently, her fasting morning glucoses run about 170 to 180. Her evening glucose levels are normal. They actually are between 80 and 90. So my number one priority with her was actually to achieve glycemic control and to maintain proper fluid intake, and to maintain her body weight. She admittedly states she does not get enough fluid as well. What I put on hers is she needs some education on proper diet to maintain her glucose levels within normal range. And at this point, I put she's relatively in a pre-contemplative stage. She's pretty happy with where she's at right now, but I feel that it would be very important for her to work to maybe control those blood glucose levels. And as far as her fall risk, I basically what I want to decrease her risk for falls while working outdoors, and in doing so, I would like to recruit her family members to assist with clearing obstacles and maybe helping her with the items that need to be accomplished when there's a risk of falling. If when they're trying to uncover the pool, maybe she should not be the one moving that material. She does have close family members nearby, and they have actually hired a gardener to do some chores, and so they're kind of in the action phase of that already. And then she requires some encouragement, some reinforcement for that. And then the next one was on her increasing the length and quality of sleep. And for that, she's kind of contemplation, working on the action portion of that. Right now she tries to do reading before bed to kind of wind her down and get her ready for bed. I was wanting to select relaxation techniques to kind of help prime herself for sleep, maybe some aromatherapy or music therapy to kind of help her progress into achieving better sleep, more restful sleep.
Okay. Very good. And so what we need to also consider while we're all going over what we're wanting to do or accomplish for our patients is, I guess, the commonalities between all of our patients together so that we can come up with that intervention, right?
Absolutely. Okay. I think I also put on here maybe working on increasing her activity level to maybe help her get a little more tired throughout the day so that she can sleep a little better at night.
Yeah. Okay. And mine too, I'll go ahead and go next. And so mine, I had the 70-year-old Hispanic female, and she had, let me pull it up right here. I know with her, she was at risk for falls because of that dizziness that she had experienced, but she's pretty much in good health and in good shape for her age, very independent herself. But still she would need some muscle strengthening, so I would say also like an exercise program, or maybe PT, home health PT could go and work with her a little bit as well. And she wanted to start, I think, like a walking program as well. Another thing with her, she also wanted to get more rest as well, but the thing that keeps her awake is watching TV. And she had mentioned that especially when she watches the scary movies, that's what tends to keep her up late at night. So we would focus on watching less scary movies, and she does have a DVR so she can record it and watch in the evening hours instead of late at night. And then with her, of course, to stay active because she does have the arthritis, and that was one of her complaints too, was that she wanted to take less medications. And she does take like chronic care meds, but those she has to take. So I was thinking in order to decrease any medications, she would have to decrease over-the-counter meds, which would be her pain medicines for arthritis. I think with her, there was also the risk for loneliness because her 2 adult children lived, they didn't live in the same town as she did. So we also needed to look at things too to keep her active with her community, with her neighbors, and with her church family, so that and for her to call her kids, not just to wait for them to call her. She could call them whenever she felt like it. So that was mine. How about yours, Bridget?
My gentleman, remember, was the oldest, so he's 89. He'll turn 90 in the fall, September. So he was living at home alone and then was having trouble managing, so now his housekeeper actually stays with him, although she works outside the home as well. so she's there just limited hours during the day. He has a little dog for company, which also increases his risk for falls. He has had a fall within the last 2 months, and he was just basically getting up from a recliner and then felt weak and fell to the ground, didn't sustain any injuries. So certainly risk for falls was one of his weaknesses there. And then he has coronary artery disease and diabetes as well, and has had some significant weight loss in the last 2 years. So for him, I really just focused on 3 main things. He didn't feel, he would like to be able to ambulate outside, but right now he doesn't feel strong enough. But he thought he could start by walking inside of his home. And 10 minutes for him seemed like a stretch, but he could do less than that. And he did agree he would put his little puppy in the bathroom when he did that to hopefully make him safer. And he does have a cane at home that he uses. So he would be able to do that. And he really is in the planning phase of that. That's not something that he's actually taking action on. The other thing for him would be to increase dietary supplements. He already does take in Boost and Ensure to help with his protein intake during the day, but he's not very consistent about it. He doesn't really have a goal for a set number during the day. So for him, that would be beneficial just to help maintain weight and strength for him. And then I also thought like improvement in nutrient intake. I think one of the things that contributes to his weakness is his lack of understanding about how his diet plays into his physical health. So for him, it would be a lot of education related to that. I asked him about maybe seeing a dietitian, but he didn't sound like he was too excited about that. So he's more in the contemplation stage of that one. But that would be a good goal for him, is to have some more education about that and to have a more diverse diet. He took in a lot of prepared meals like Fong's lady, I believe, and so he's using frozen meals, and then also canned foods. So.
Okay. All right. Do you guys have anything else to add to topic 1 then, of the recap of our health promotion plans?
Well, it kind of sounds like everybody has some issues, concerns with diet and activity. So I wonder if there's something,
That would
that
go
we might want to go out, start kind of branching off of.
Okay.
Yeah, it looks like also risk of falls.
Yeah.
Yeah.
So I think that would add to mobility.
Right, or activity strengthening sort of thing.
And also, it looks like we all have like some kind of component of social interaction or support also that they need to be a little bit more involved in, or have someone to lean on.
Yeah.
Mm-hmm. All right, those are good points to go with.
Excuse me.
All right, let's move on to topic 2 then. So we're sharing the articles for this week involving the health promotion proposals, project management, or presentations for funding, and I had annotated the keywords that Dr. Dowling had listed on those notes. And so I had emailed you guys some articles, and it was kind of late, just a little bit before our meeting time. And then Bridget also sent over one, and Fong, you did too, real quick. We were driving home, Beth. But I didn't get a chance to read over everybody's as well, so maybe we'll have a chance to look those over more, and we can come back to topic 2 later, and we can go back and say, or come back and say if we want to meet again this week, or if we're just going to do it by discussion board. What are your thoughts?
Well, I can just go over mine real fast, just a real brief general summary of it. My article was on basically a discharge planning intervention to prevent readmission emergency visits. 3 things that they had covered was drug-related readmissions, so drug-related adverse reactions, probably further education or taking too much for regards to polypharmacy. Another one was depression that contributed to readmissions, and the third one is malnutrition.
Hey, so, sound familiar?
Yeah, so we kind of go off of that. Obviously, we'll kind of set the mood for readmissions, is assessing patients' any kind of depressions that this demographic have, especially being 65, living alone. You know, if you're not having that much of the support, I wonder how much it actually contributes to them, their striving and thriving part of their lifestyle.
Mm-hmm.
A lot of the articles that I looked up had a lot to do with improving, like more of an intervention of improving diet and improving exercise level to strengthen, to help increase their self-efficacy with living at home. And different programs that have been implemented, how they implemented it, what they did. And there's one of them, I almost finished it, and it was talking about their financial planning for it. So I did a lot of, I found a lot of those, and I think they were actually quite helpful. And once we get done here, I'll post those on the discussion board as well, so you can get the link to read them if you'd like to.
Okay. And I know I didn't get to look at yours. I just looked at it really quick. Bridget, did you want to talk more about it, or do you want us to?
Sure. So the one that I sent out via email was more about developing a plan to present, and it talked about communication styles to give an effective presentation. Part of the assumption that the article makes is that we know the facility better, like the one that you would work in, than we're going to for this, so that makes it a little bit challenging. But it still talked about the important components to communicate when you're wanting to get that support from senior leadership. And then the ones that I had posted to the discussion board were related more to intervention stuff. So one was a simple intervention of increasing like activity, and the patients were using a pedometer. And actually their primary care nurse was the one that was kind of acting as their coach once they got discharged home, and then would follow up with them through phone calls or through visits just to see how it was going. They kind of set personal goals. So that one was kind of interesting. They didn't increase steps a huge amount, maybe 1,000 steps a day, I think over 12 months if I'm remembering correctly, but was still an increase for that population.
Yeah, hopefully, if they're technology savvy, what they can do is we could kind of incorporate this into our intervention and outcome part of it. Is they can just log into the computer and we can just view it on a daily basis, which is nice.
I actually have an article right here. It's a case study on the Interact Home Telehealth project, and it's along those same lines. It was kind of cool.
Okay, so and then I had emailed the two, and mine were pretty much like the one that Bridget had emailed also regarding the project. And the one that I liked though was developing a checklist for research proposals. And that one, it provides a checklist of the things that we should include with our proposal for our PowerPoint. So, and I'll share these on the discussion board too, just so that that our professor could see that what we've come up with, I guess. So everybody share their articles then on that discussion board as well, okay? And then we'll talk more about that. But that's the one that I liked too in regards to the proposal. I know that's going to be a big deal. We need the money. We need the 10 grand.
Well, I'm a big for that telehealth.
You're what?
I'm a big supporter of that telehealth.
Oh, yeah. We need to get them tech savvy though, huh?
Well, that's another thing we can assess prior to discharge though. Telephone.
Yeah.
I had a thought after reading one of the articles, and it was a study put in effect in Australia, but because they're so spread out. But what they talked about doing was like a monthly support group meeting between this specific population, where they would come in, they would do meal planning activities, and generally like peer support, that type of thing. So they not only learned how to do, make their grocery list, do their meal planning for the month, but they were also able to build friendships so that they had that support system as well. And my thought on that was if we did some training on, I have it outlined, I should just read it, have a designated facility where they would meet once a month. those that cannot make it because there's transportation issues, if we had like a like telehealth type thing where they can do like a Google Hangout or something like that, so they can still participate. But of course, they'd have to be tech savvy or have somebody that could help them with that. Still participate in the sessions and still get benefit out of it. You'd have to, get some sort of like an iPad or something like that that they could rent from the program. And then as far as supplies, a computer system that you'd have for wherever you're setting up your meetings at, for the facilitator to use so that they can communicate that way. So I don't know if that's something that might be a start or something you could throw into the mix.
Mm-hmm. Yeah, because it could work out for those tech savvy ones. I mean, we could have it to where the tech savvy could do this, and then we'll still have the old-fashioned way, I guess, of doing things too. So I mean, we've got to be innovative, is what Dr. Dowling keeps saying. Be innovative. So I think that's innovation.
To fall in the lines of that right there, I think we want those patients there rather than just sitting on the couch and watching the video.
Right.
But I know there's a lot in California. We have like programs for kind of like a ride and share, or if we're networking, if they're socially networking at these, let's call them community centers. If we're using community centers of our city, or they can build that social networking where they can kind of carpool with one another.
Right.
And also, there's also transportation van pools and buses and stuff that they can utilize. I think that'll be good. That's something that we can kind of incorporate all together. But I do like that program. But obviously, they build that relationship. They're going to meet more than once a month. So that's just something where all the circles get together.
And that'll gradually build into a bigger social support group too, and encourage walking groups in the community later, outside of those meeting times.
Those are good ideas. How are we doing with time, Fong?
We are 21 minutes in.
Yeah. Oh, that's not bad. Okay. All right. So let's go. Does anybody have anything else to add to that? That was our topic on articles that we just discussed. That was good. That was a lot of good info. Nobody? All right. So let's begin. That kind of ties into topic. We're deciding on the intervention, right? So that ties in. Let's move on to topic 4 then and discuss the AAB PVP slide layout. And so what I just did was printed out what Dr. Dowling had posted for us on our notes, and so you had said 10 slides, right?
Yeah, but that's just a start for the template. But obviously, we can have more. We have more to add, so it'll be a continuation of the topic itself. So subtopic.
And it must not exceed the 15 minutes. Everyone must have worked in its preparation. No exceptions. Okay, so the slide lineup. Do you guys know what I'm talking about? That Dr. Dowling posted on the notes.
Where it says title slide and then objectives for presentation. Yeah. Okay.
And so that's what I'm kind of going off of. Everybody else has that too. Did you guys see it?
Yeah, I have it too, Dessa.
Okay, good. So that's all I was looking at, the title slide. Now, do we want to come up, how do you guys want to do this? The title slide, we got to come up, is it going to be the greater than 65-year-old? What did we have the first week? What did we write down?
We had a 65-year-old living alone.
Yep, older patient.
Basically, our goal is to reduce readmissions, 30-day readmissions.
So we can have that same thing then that we put down in the scenario, but just preventing readmissions.
Yeah, so what we could do our title of our presentation, and then we have our group name.
Okay.
Or group name first, and then we could do a description of our presentation.
So And Bridget, you had already posted the slides onto the Google Docs so that we could all start adding in. Is that how we want to go ahead and start doing it? The way we...
I wonder, and we all have to take turns doing our sections and writing the notes in. Do we want to divide up that today so we can work on that, or?
Yeah, we can do that. If not, all four of us are going to be working on slide 2.
Right.
Because this is and really what I was thinking too is that the one assignment that we turned in. I can't remember if it's the one that I can't remember if it's the one that you turned in for us all, Bridget.
Oh, that has the summary?
The summary.
Compilation.
Uh-huh.
It has a lot of information in it, really.
I think we can get from that one and the one that we turned in the week that you were the team lead, Beth, because that one also has everything kind of coupled.
Yeah, the theories,
mm-hmm.
theories and the definition of health promotion.
Right.
I think the only things so that part of it is going to be the easy part. Like if you see the first few bullet points.
Right.
1 through 5 maybe.
Yeah, those are going to be the easy ones. And then once we go into what is the significance of the problem in providing statistics, then we're going to have to go ahead and go into some research there.
Yeah, we can just pull up readmission figures of this demographic or overall. I think it's just an overall problem, especially with the CMS guidelines now.
Mm-hmm.
Right.
The ones that we're going to work all together is going to be our intervention and our evaluation of it.
Uh-huh.
And then it seems like we could probably move through the next couple, but then we almost have to, before we move, like, see, the first 8 maybe would be something we could do this week, it looks like, but beyond that, you have to develop a budget. So we'd have to be more sure on our intervention details, which I think is going to take a little time to buff out.
Do you guys want to draw the line right there for this week? Is all the info that we have already up into, and we can go into the intervention part of it and the rationales, because that's in our health promotion plans that we turned in this week, past Sunday. And then next week we can look into the budgeting of it all and how we're going to roll it out in the facility. What do you guys think?
That's fine. If we start getting all that stuff kind of plugged in, and we know that we're ahead of the our deadline, we could just kind of continue. We can just add on the slides, or communicate to one another prior to doing it. We can text each other, or we can start post it on a discussion board. Just our suggestions.
Okay.
I know it seems like all of our issues with our clients or patients, they're quite similar. It's just creating a program where it can deal with all of them.
Right.
And not making it so complex that it's really hard to gauge effectiveness. I think that's the challenge, is getting enough in there for an intervention without going beyond, because there's so many for the elders opportunities for assistance.
Yeah.
I think our current resources are there. I think that what we should do is kind of expand what programs are already available, like calling the patients back, see how they're doing, making appointments for them, delivery on from pharmacy if they can't get to that place, or assisting with transportation. Just having resources readily available for the demographic, and having like if they have issues with any signs and symptoms that they think that they're going to be hospitalized, they can just call the hospital. We're not going to give them any kind of consultation, but we can just kind of cue them. Have you taken your medication today? What's going on? Before it gets worse, just come to the hospital. You know, if they need a dose of IV Lasix just to get them out of their danger zone, then that would help quite a bit. That's not going to count against our readmission.
Mm-hmm. Yeah, that's the easy part. It's all the rest of it that looks a little bit more That's what we haven't really looked at, like sustaining the interventions after funding has ended. Have you guys looked at all of them?
Yeah.
Okay, well, I think I agree. I think we should just go ahead and start cramming into the slides that we are pretty sure about right now, and then we'll get together again to start going over or start researching for the other part of it, the money part. I don't do the money stuff.
That's Bridget's work right now.
Very
Yeah, I don't mind the money stuff so much, but
yeah, it's very new to me. So, anyways, we'll do it. We can do it.
we can.
Get that funding.
I'm sure I can look up some nursing or care management scales in Arizona, so we'll know what that'll cost.
Do you guys have anything else to add to the slide layout or anything about the actual presentation? No?
No.
Moving on then. So topic 5, discuss the team and group name. What did you say, Fong?
I said, never the wiser. Not Budweiser, but never the wiser.
I like it. I think I like your point on that. On how it's at that age group.
Yeah.
Okay. I like it too, so it has my vote.
Okay.
Yeah.
Okay, so that's the
Creative.
Great. Never the wiser group. Okay, and so then topic 6, determine if second Google Hangout meeting will be necessary for this week. What do you guys think?
I wonder if we, see how we do with what we've got out ahead of us now, and then maybe towards the end of the week reevaluate whether we need one or not.
Okay, so we have the slides already posted to the doc. By when should we already have stuff in? Do you guys want to say by Friday night? Does that give us enough time?
Friday night's okay with me. I hope.
Yeah. Remember, Sunday is Super Bowl.
Yes.
I'm working.
Plus, it's my daughter's first birthday on Saturday too. So.
Oh.
Happy birthday. How about for you, Bridget? Did you like, I mean, we don't have to be complete, but at least we'll have some entries posted into those slides, some things.
Yeah, I think Friday works fine. Because I think getting together at the end of the week is going to be really important to just say that, yeah, we're all okay with the intervention piece of it, because that's the piece that still needs some definition, but I think we have a lot of great ideas for it. So that's the good part.
For sure, then, we do want to have our intervention and all those components associated with it into the slides by Sunday night. Yeah? So then that way we have Module 6 to work on the budget and all of that money stuff.
Okay.
Okay.
So where are we stopping? Just on the intervention part?
We can add to it anytime, but for sure by Sunday we want to be done with all of that.
Okay. So I think to throw it out there, I don't know, that would be helpful. We should just focus on a short-term goal, and the long-term is going to be the sustaining part. So whatever we can fix now would just probably be a lot cheaper, and then the sustaining part, well, actually the short-term might be more expensive. Sustaining might just be a lot easier. Especially if we have everything in line.
That's a good idea, Fong.
Can you throw in one thing, and I'm rambling on, but just for like the physical activity, you know what population or people we can actually utilize for free to assist with like the community center, Beth, that we're going to create is interns for physical therapy to give them the hours.
Yeah,
there you go. That's a great idea. Well, and lending to your short-term and then sustaining, since reducing 30-day readmissions is our goal, should we focus initially on that first 30 days? Our goal is to keep them home at least that long.
Yeah.
And then worry about after that.
Perfect. That's perfect.
All right. So then, what time? What are we at, Fong?
We're at 35 minutes. I think we start at 7:59.
Okay. So items to consider that I listed in the agenda. So of course we have that due date on Valentine's Day for our PowerPoint presentation. Let's see. So, and then she had mentioned to use Module 5 and 6 to finalize the project, which is what we're doing. And then interventions based on assessment findings by group. This is what we pretty much discussed at the beginning of our meeting tonight. And then we need to be tying in the theory to our finding or to our interventions. What do we have? The short list. We have the theory of reason and action, the theory of planned behavior, and then social cognitive theory. So is it just one theory, or does it have to be all three of them?
I think we can choose what's most appropriate.
Okay.
There was an interesting piece, too, posted in the news, though the references for the slide presentation can be at the end. They don't have to be on each slide, so that's something to think about when you're going through.
Okay.
Just to compile.
All right, and so goals for Module 6. Who is the team lead for Module 6?
I think that's me. I don't have it in front of me, but I think that's what we had written down.
Yep, it's
Yeah,
you.
I think you are, and I'm the timekeeper again, the gatekeeper.
And I'm the submitter. We all do something, and Bridget is the scribe. Okay, so goals for Module 6, and of course this can always change as you see fit too, Beth. We're going to meet on the Google Hangout. Do you guys want to say early next week, so Tuesday again?
Yeah.
Yeah, that's fine.
Okay, and
I
then
work
that would be
I work Tuesday day, so we can keep it at 8:30. That would be great.
okay. So we'll still stick with Tuesday, 8:30. And then that's for finalization of the advisory board proposal presentation. And then I put focus of this module will be on the evaluation of the entire project. That's all I have to say about that. Shall we do a round table starting with Fong?
Well, just to recap on that, I think we have to have our 15-minute recording also, so we're probably going to meet twice next week.
And we can figure out the next meeting when we get together that night.
I will not be able to participate in anything on the 12th, just because my my family shoots fireworks, and we are being paid to shoot fireworks for some winter festival, and so I'll be gone all day and night that day. So I'm good for Thursday or Saturday.
Okay.
I'll be blowing stuff up though on Friday.
Yeah, so Saturday, I think I work Saturday and Sunday, but if we need to record Saturday, I'll be home by then. I'll be home by 7-ish, so at 7:30 we can record.
Okay.
Yeah, I most likely won't be home till like 10:30 or 11 on Friday. So.
That's for next week, right?
Yeah.
Yeah, the weekend of Valentine's Day.
Yeah.
Okay. Well, I might be busy Saturday night, but it's okay. I will. I will make time for you guys. My Valentine's Day dates. My husband will be cool with it. Yes, So do you guys want to do roundtable? Fong, do you have anything to say about this week or?
No, I don't know. You guys, we have a few minutes left. If you want, should we just kind of brainstorm what kind of interventions we want to do?
Sure. I liked your suggestion about utilizing interns. That's a great idea.
Absolutely.
Yeah, there was a great research article, and I'll pull it up again, about congestive heart failure, and they utilized students. Of course, it was a bigger area than where I live, but there was several colleges in the town, So they utilized med students to call the patients back because, one, they already had the education piece, and then they often saw the patients in the hospital and had the extra time to do that.
Well,
Yeah.
we can do the same thing.
Yeah, so I'll check into that article and forward it to you all.
And that's what we're doing at our clinic too. We're having graduate students in public health and also pre-med students coming in, and they're doing the questionnaires for some of our patients on health disparities. And so, like, if we look in the hospital and if we didn't, for example, have a case manager to go over the assessment tool prior to discharge for that patient, it could be one of those students as well, because like the physical therapist students, they need to put in hours as well.
Yeah.
And that would save us money too.
Yeah.
Absolutely.
Instead of monthly, we could actually do it like if it's feasible, where we can set it up at a community center. Obviously, if it's like a county or a city convention center or something like that, it's pretty much probably gonna be free. They can do a write-off for that, and then we could just have our staff come a couple hours just to kind of teach these interns what to expect and what to do. That's just the cost right there at the front end.
Your initial training on what the plan is and what the interventions are, and then kind of go from there.
Right, and then we could also have the providers be a satellite and just use like the iPad or something to beam in.
And then maybe the interns or whoever's being the facilitators, they should, maybe have a weekly check-in where they touch bases with program coordinators just to, first let them know what the progress has been made, or maybe not weekly, but so that there's communication between everybody, so everybody involved in the program knows where we're all at on that, versus okay, now we're going to be working with the patients.
Yeah. Sounds like a good program already.
You know what, we need to plan how we're going to be measuring the outcomes.
Well, first measurement is going to be monthly reports on readmissions.
Right.
That should be the #1 outcome evaluation.
So how are we going to do it? Are we going to keep what list were you mentioning, Fang?
Usually the case managers, they get that the printout. If they get a patient that comes in 30 days prior to, they get flagged. So there's a program that it's capable of printing out like a monthly report on how many 30-day readmissions that you have for the month.
Okay, so that's one way to measure it.
I wonder if we can also do some measuring the patient satisfaction with the program. If they want more or less information, a recipe of the month or something like that, to for like their meal planning, to keep their diabetes under control, to reduce their readmission rates.
How about a newsletter?
A newsletter would be great.
Or we could have a blog or something.
Or both.
Yeah.
Yeah, that's a good idea.
Mhm.
And I think we should be able to find some good information about the cost of readmissions. So that will be helpful.
Yeah.
In planning, what you recoup in those savings.
What was that, Fang?
I wonder if we could probably just go on CMS and see.
Right.
Yeah, because
Ask my CFO, see how much we get dinged for it.
for a readmission, yeah, because you don't get paid, right? You don't get paid.
Right.
Okay. Okay, and then how do we plan on evaluating the project once it has been completed?
I think with your, compilation of your monthly 30-day readmission rates per month versus for the whole year, do we step into the like monitoring their hemoglobin A1C, or I mean, how much do we need to monitor on this?
Well, because you can go in the financial aspect of it. You can go in from a year ago when we weren't implementing any of this that we're going to do now versus now, and how much money, if we have saved or if we have gained or lost. I think on that level,
versus
Yeah.
that, and then if it comes to like quality patient care, then look at the readmission rate. If they're, I don't know how to. I'm sure there's a good way of determining that. Maybe if you look at the individual.
Falls in line with revenues.
Mm-hmm.
It just falls in line with revenues.
I like your thought, Dessa, on maybe totaling up the cost of readmission rates for 2015 versus your cost of readmission rates for 2016. Is that what you were kind of talking about?
Yeah, but we would have to set the parameter of after how long, because we're not going to have a really long time.
Maybe do it 3 months, 6 months, 12 months.
Quarterly.
Yeah, and then we could probably graph it.
Mm-hmm.
We could do quarterly graphs, yeah. So, okay. And I'm just looking at like the parts of the presentation that we haven't touched on so much, but and then we have to consider the resources from the hospital that would be useful for the intervention as well.
Resources such as is this a teaching hospital where you do have interns? Those are definitely resources, I would say. Or can we utilize? Is there an empty classroom that we can utilize for these support groups?
Mm-hmm.
Or a teaching kitchen.
Well, there's conference rooms and stuff.
Conference rooms.
There's
yeah.
DHRA has a huge one, I heard.
Did you do that?
So we'll utilize the conference room.
I guess
I wonder if we're utilizing the physical therapy interns. Can we use the physical therapy department for some of their therapeutic exercises? Or does that border into like reimbursement rates, charging Medicare for physical therapy itself?
Yeah, I think we would have
that
to
might be too much.
Yeah, it might kind of fall into some challenging areas there. There is, different phases of cardiac rehab, but then you actually have to be in the cardiac rehab program. I think the phase 2 is the one where it's really more just that strengthening physical activity, but usually that's a self-pay. So I guess it's potential if there's something that's built like that.
Another outcome that we kind of measure is how many participants are taking advantage of the program.
Yeah.
True.
Mm-hmm.
And what's our dropout rate? I think that would be a way to know, if we're providing things of interest to people.
Yeah.
If the dropout rate's low, you got to assume that they feel like it's beneficial.
Yeah, we'll just have to go off that patient satisfaction.
Well, and that can be a continual, obtaining feedback from the participants too. What do you like about the program? What would you like to see us change? And then you can improve from that.
Yeah, and then get to a certain point where are you willing to pay for extra services?
Right.
Independently.
And maybe, like the sustaining process would be just to do those 3-month, 6-month, 12-month evals as a team, not only to know about the financial impact with readmission reduction, but to see where we are in the satisfaction. And then at that point, you would tweak it. Like maybe they want more dietary education, or a certain piece didn't work, so you'd eliminate it.
Mm-hmm.
Yeah.
Mm-hmm.
Well, we're 49 minutes in, just FYI.
Thank you. Thank you, gatekeeper. Okay. Do you guys, well, this is all a lot of good information. So now it's just a matter of putting it all together and making it sound really nice and presentable. And the thing is, like, when I think of PowerPoint presentations, because I think of, even when I'm reading a PowerPoint presentation, I don't want it to be like information overload. I really just want the key points and then the presenter to just talk about those key points. But when I'm reading the actual slide, give me the highlight of it.
Yeah. Well, we could put all that discussion on the notes.
Yeah.
Uh-huh.
So now I have a question on this because I am not super tech savvy.
You're gonna ask the same thing I am.
When we put this PowerPoint presentation, are we going to do this like we're doing right now, but be able to click through the presentation and take turns reading it, or how does that work?
I think that's what we're supposed to do.
I think so.
Okay.
Mm-hmm.
And who knows how to do that?
I don't either.
Well, we'll figure it out.
I don't know how to. It's not when you share a document.
Well, you know what? I know when I
Was it the screen share piece, Dessa?
Yeah, I think it's the screen share, but we're gonna have to investigate that too.
I know when I did our introductions, that first module,
Mm-hmm.
I did a PowerPoint presentation and I was able to read over top of it, but I honestly couldn't tell you if you could have invited somebody in there so that there was more than one person talking. Maybe we should practice.
If not, we'll just hold it up like this.
That's what I did for that introduction part.
Well, and I did mine as a PowerPoint, but I never thought about having another person talking at this, like we're doing now.
I did that too, but then when I went to record my voice, I heard it was echoing, not like the way it did earlier today or with Fong that other day, but it was just like an underwater echo, and it didn't sound right, so I didn't want to turn that in. So I just did what Fong just did. So, this is me. This is my family.
So when we get together next, should we just practice?
Maybe
if we can manage it.
Yeah.
That might make it shorter on the end, anyway.
15 minutes.
I know. Succinct, right? That's our goal.
Succinct, yes. I don't have anything else to add. Do you guys?
I'm good.
All right. So we already have the slides posted on Google Docs, and we will start.
Hello?
Hello.
There. You guys totally freeze up, or was it just me?
No, it's all.
All right. Cut it.
Oh my God.
We're having technical difficulties.
So,
It's the sign. It's the sign to stop.
Wrap it up.
All right, guys. It's been wonderful.
So we'll have everything ready, and if we need to have another meeting, we will talk about it on our discussion board, right?
Yeah. Super Bowl halftime.
Yes.
Okay.
See you guys later.
All right. Good night, guys. Thank
Have
you.
a good night.
You
Have
too.
a good night.
Good night.
Bye.